So, good morning to all. Today topic is pleural effusion. So, pleural effusion is one of the disease conditions which come under the respiratory system. Pleural effusion is the upper respiratory disorder. Okay. So, now we can start with the topic pleural effusion. First, we know the normal lungs anatomy and the physiology. In the normal anatomy and physiology of the lungs. Lungs are which shape of the lungs? Lungs are having the soft, spongy, cone-shaped organ located in the chest cavity. Then lungs कैसे हैं shape में? Soft and spongy and cone-shaped organs है. Where they are located? They are located in the chest cavity. They are separated by the mediastinum and the heart. Okay. There are the two lungs, right lung and the left lung. The right lung is divided into the three lobes, upper, middle, and the lower. And the left lung should be divided in the two lobes, upper lobe and the lower lobe. Then lungs. Now it is the anatomy. Then second is the what are the physiology? What are the functions of the lungs? So lungs are supplied with the blood. So with the help of the pulmonary circulation and the bronchial circulation. So first is pulmonary circulation. Pulmonary circulation is helpful in the exchange of gases are there. Okay. And bronchial circulation is helpful for the nourishment to the lungs. And in the bronchial circulation, it provides the systemic and nourishment of the lungs. It will be helpful for the lungs for the nourishment and the systemic provide the systemic nourishment of the lungs. Okay. So first in the pulmonary circulation. In pulmonary circulation, what are the function of the pulmonary circulation, pulmonary veins, what they will be do or the arteries. So in this arteries, pulmonary arteries should be split out the left pulmonary artery and the right pulmonary artery can carry the deoxygenated blood from the right ventricle into the alveolar capillary networks. Okay. So arteries and the pulmonary veins, they should be carry the deoxygenated blood from the right ventricle. Okay. So here veins, there are the four pulmonary veins are there. They can return the fresh oxygenated blood with the help of the capillary beds into the left atrium. Okay. So what are the arteries? Artery carry the deoxygenated blood. Arteries क्या करेंगे हमारी? Arteries will be carry the deoxygenated blood from the right ventricles. Okay. Then veins. Veins will be क्या करेंगी veins? Veins will be carry the oxygenated blood from the lungs to the left atrium of the heart. Okay. So next is your bronchial circulation. In the bronchial circulation, bronchial arteries will be supplied from the descending aorta. Okay. Then veins, bronchial veins drain the deoxygenated blood in the majority of the system. Okay. Bronchial veins carry the deoxygenated blood and it carry like small physiological shunt are there. They can be drained into the system. Then we can go for the, you can understood the what is pulmonary circulation and what is bronchial circulation. So next, layers of the lungs. Now lungs is having the layers. Lungs is covered by the three layers. So first is your parietal pleura. Second one is your pleural spaces. Third one is your visceral pleura. So in the parietal pleura lines the thoracic cavity, including the thoracic cage, mediastinum, and the diaphragm. Okay, so lungs is having the cavity, so that should be covered with the help of the thoracic cage, mediastinum, and the diaphragm. Then pleural spaces. Pleural spaces are the spaces present between the lungs and the parietal pleura. So it can be transparent. Cirrhosis membranes are there, and there is a space between the parietal pleura and the visceral pleura. Visceral pleura, there are the lines, entire surface of the lungs. There are some lines are present in the lungs. So with the help of this structure, we can know here, this is your lungs. Okay, right lung and your left lung. Here, one line is there, that is your parietal pleura. Okay, with this, one space are there. Space is there, है ना? So that is your interstitial spaces are there. Here, pleural cavity with the cirrhosis fluid. In this space, cirrhosis fluid is present. And here, visceral pleura is there, and that structure is this diaphragm is there. So here right lung is there, left lung is there. That covering, that first covering is your visceral parietal pleura, that is your outer layer. Here one another layer is present, that is visceral pleura, that is the inner layer, that envelop all the surfaces of the lungs, including the interlobular fissures. Lungs is having the some structures are there, alveoli, bronchioles, bronchi. So these will be covered under the visceral pleura. And at the hilum, one space is there, that structure where pulmonary vessels, bronchi, and nerves enter into the lungs. The parietal pleura continues with the visceral pleura. Okay. Then introduction. Pleural effusion, we can know with the name, with the disease, it is come under the respiratory system. Okay, so pleural effusion is one of the disorder of upper respiratory system. So here, pleural effusion, what is pleural effusion? Accumulation of fluid in the pleural spaces or pleural cavity is a rarely primary disease process, which is usually secondary to another disease. Okay. The pleural spaces, normally in the pleural spaces already 10 to 20 ml of cirrhosis fluid are present, but more than 10 to 20 ml of cirrhosis fluid is there, so it will be caused a disorder or disease in the person. So with this, we can know the patient is having any disorder. So now we can go for the definition. What is definition? Pleural effusion is a collection of abnormal fluid in the pleural spaces. If there is a abnormal collection of the fluid in the pleural spaces, that will be called as your pleural effusion. Presence of large amount of fluid in the pleural spaces, irrespectively of underlying causes, are there. Okay, so you can understand the definition. Pleural effusion. Pleural is the cavity of the lungs, and effusion, accumulation of the fluid. With the two words pleural plus effusion, collection of abnormal fluid in the pleural spaces. So now we can go for the classification with the name transudative effusion and exudative effusion. Okay. So here transudative effusion, and next is your exudative effusion. Intratransudative effusion occur due to the increase in this hydrostatic pressure should be increased and low plasma oncotic pressure. If the pressure, hydrostatic pressure is increased, so there is a less space present inside the capillary. So oncotic pressure should be low. In this condition, there is no inflammation in the patient, and patient is having the low in the protein. If the patient is having the transudative effusion, so they are having the congestive heart failure, cirrhosis of liver, kidney disorder, hypoalbuminemia. But in the patient with the exudative, it is the opposite of transudative. Occurs due to the inflammation and increased capillary permeability. Patient in this, inflammation is there and capillary permeability should be increased. Patient is having the pneumonia, cancer, TB, viral infections are there. So first we can study about the transductive effusion. Transductive effusion is also known as hydrotheresis. Patient is having the accumulation of fluid occur in the non-inflammatory condition. In this patient is having no inflammation is there. There is nothing, there is no any type of inflammation is present inside the patient, but the protein level should be low. Then what are the causes? If patient is having the increased hydrostatic pressure found in the heart, if patient is having the heart disorder, more pressure on the heart, it will be lead to transductive effusion. Decrease oncotic pressure from the hypoalbuminemia found in the cirrhosis of the liver or the renal disease. In this condition, fluid movement is facilitated. In this condition, fluid is already come outside from the capillaries, because capillaries having the less spaces, pressure should be increased, so that will become outside the capillary. Exudative effusion. Exudative effusions occur in the area of inflammation. It is an accumulation of high protein and the fluid. So in the exudative effusion, where inflammation is present, high protein should be there. And etiology, what are the causes for that? Disseminated cancer. If patient is having the lung cancer, breast cancer, lymphoma, pleural pulmonary infection are there. So with the help of pneumonia, patient is having the pneumonia, upper respiratory tract infection. So it will be caused to the pleural effusion. If patient is having the heart failure, cirrhosis, nephrotic or any kidney disorder, so in that case is also. If patient is having the peritoneal dialysis, at that time peritoneal cavity is having the accumulation of the fluid. The dialysis cannot be removed proper fluid from the peritoneal cavity, that fluid passes to the lungs. Then with this structure, we can know here in the normal, here in the normal, there is normal hydrostatic pressure is there. Okay, colloid osmotic pressure is there. Plasma proteins are reaching the capillary normal. But in the transudative, protein is low and there is starting of leakage of the fluid from the capillary. Decreased osmotic pressure is there. Increased protein loss is there. Now, protein loss should be increased. So, patient is having the kidney disorder. Like in the exudative, high protein content should be increased, and fluid protein leakage is also there. Vasodilation and status is there. Here, the vasodilation is that capillaries should be dilated and increase endothelial spaces. So, with these two of these, patient is having the inflammation is started in the patient. So, it is low protein content, and here it is high protein content. Okay. So, main difference is this. So, next is pathophysiology. In transudative pleural effusion, it will be due to the causes. Hydrostatic pressure should be there. Increase oncotic pressure inside the capillaries. Once increase oncotic pressure is there, so unable to remain the fluid inside the intravascular spaces. अगर एक बार स्टार्ट हो जाएगा हाइड्रोस्टैटिक प्रेशर इंक्रीज होना स्टार्ट हो जाएगा, जो कैपिलरीज होंगी properly plasma cannot be stay inside that. So it will be start moving from the capillaries and it will be shift their spaces. Then exudative invasion of microbes. Microbes are present. If microbes are present, the inflammatory process should be started. So vasodilation increases, capillary permeability is there. Leakage of plasma protein, decrease the oncotic pressure is there. Vasodilation should be increased. If the capillary should be dilated, so it will be cause the capillary permeability. Leak of the plasma protein decrease the oncotic pressure. If leakage of the plasma protein should be started, so oncotic pressure should be decreased simultaneously. Then what are the clinical manifestations? With the name, we know that it is a respiratory disorder. So patient is having the difficulty in the breathing. Okay, patient cannot be breathe properly. So first is the shortness of the breath. Patient is having the shortness of the breath. Fluid filled in the, there is a fluid that is filled inside the lungs or the spaces. So it will be causing the patient to take many breaths. So get the oxygen cannot be reaching the lungs properly. So patient is having the pain and the sharp stabbing fluorated type of pain is there. Some patient will be have the dry cough. In some patient, there is no symptom will be come out, only the dry cough is there. Then recent abdominal surgery. If patient is having any type of surgery, cancers are there, TB, pneumonia, in that case is also patient is having a pleural effusion. Patient is having the absent breathing. There is no breathing or decrease in the breathing. Then with the help of these structures or the diagrams, we can know the patient is having the chest dullness or stony dullness sound is coming. So here pneumonia causes a fever, chills, fluid chest pain in the patient. Now, what are the diagnostic evaluation we can do to identify the disease in the patient? So, first we can study uh, what is pleural effusion. Okay, what is the introduction of the pleural effusion? Then definition of pleural effusion. After that, classification of pleural effusion. Then, what are the etiology for the transudative and exudative pleural effusion? After that, we can study the pathophysiology of both of these. Then, after that, what are the sign and symptom patient is showing? After that, we can go for the diagnostic evaluation. In the diagnostic evaluation, with the help of physical examination, we can know patient is having this disorder. Then after that, we can suggest the patient for the X-ray. With the help of the X-ray, we can identify patient is having the pleural effusion. Then patient is having the heart failure or any another condition. So with the help of this, we can take the patient history. After with the help of this X-ray, we can know here cloudiness is there. So here patient is cloudiness is there. So with the help of this, we can identify. Then if firstly, we can take the personal history of the patient, the respiratory history of the patient. After that, we can take the physical examination of the patient, X-ray of the patient. After that, we can go for the ultrasound. We check the normal amount of the fluid inside the patient lungs, like 3 ml, 5 ml, or there is any abnormality. Then chest radiography, with the help of X-ray, we can identify. Then with the help of CT scan, we can take the 3D dimension of the patient. So with the help of CT scan, we can identify cross-sectional computer tomography. It helps in the distinguishes the anatomical compartments. Then thoracentesis is the procedure which can helpful in the pleural effusion. What are the management? In the management, we can know the underlying causes of the disorder. Okay, we can know the underlying causes of the disorder. Then, according to the causes, we can relieve the patient. If patient is having the dyspnea or breathing difficulty, so we can maintain the breathing pattern. Therapeutic thoracentesis will be there. With the help of thoracentesis, we can remove the extra fluid from the chest cavity of the patient. Okay. Then we can go for the, with the help of this structure, we can know where the fluid is present in the patient chest. Okay. Here, here. Okay. And then, what are the complications? If patient is having the pleural effusion, if it will be not treated at that time, so patient will be having the respiratory failure. If once patient is having the respiratory failure, patient cannot be survive for the further time. So we can be manage the complication and then reduce the chance of the respiratory failure. And now, what are the nursing assessment? Okay, in nursing, firstly, we can understand the introduction, definition, classification. After classification, causes. After the causes, we can study about the pathophysiology, diagnostic evaluation, management. In management, we can study the medical management and the nursing management. In nursing management, firstly, we can obtain the patient history, assess the patient for the dyspnea, auscultate and percussion of the lungs we can do. Then in the nursing interventions, ineffective breathing pattern related to decreased lung expansion. Okay. Then accumulation of the fluid or evidenced by the dyspnea, changes in the depth of the breathing and accessory muscles we can be used. Like in the intervention, we can maintain the normal position of the patient and maintain the breathing pattern of the patient. Then acute pain related to accumulation of the fluid in the pleural spaces. Patient is having the breathing difficulty, patient is having the pain. So we can reduce the pain, we can taught the patient to the relaxation or easy exercises. Chest tube drainage should be there, prescribe the analgesics to the patient. Then after that, we can see patient is having the imbalanced nutritional status, risk for a nutritional impairment, less than the body requirement, related to inability to ingest and inadequate nutrients. So we can be maintain the patient nutrition level. Okay, then risk for the fluid volume deficient. Patient is not taking orally. The patient is having the chest tube drainage, so we can maintain the IV fluids to the patient. Then patient is having any incision or cut, okay, in the drainage side, so risk for the infection is also there. So according to the infection side, we can be maintain the manage the patient. So these are the references. I am referring these books for making this PPT and the Google. So if you are having any doubt, you can ask. Okay, so today we will be discuss about the pleural effusion. Pleural effusion, what is pleural effusion? Pleural effusion is accumulation of the fluid in the pleural spaces, more than 10 to 20 ml of the fluid. Okay, so next we can study about the classification, causes, etiology, pathophysiology, diagnostic evaluation, and the management. Okay, so you understood. If anybody is having any doubt, you can ask. Okay. Okay. Thank you.